guest is a leader in designing and distributing rapid tests for a range of viruses and diseases, including COVID-19. He is the CEO and medical director of a company called API, Abacus Pharma International. Welcome, Dr. Vincent DeGennaro. Dr. Vince, welcome into Tomorrow. How are you, sir?
Thanks for having me. I appreciate it.
It's a pleasure. And before anyone gets concerned about our lack of social distancing or our lack of wearing masks during this interview, I'll tell you what. Before we did the interview, we tested, all of us. And fortunately, we'll tell you those results. But we're good in this case to not have to worry about that social distancing and here in the studio environment. Dr. Vince, tell us what we're going to do in terms of the testing.
Yeah, I mean, we're just going to do it easy, a finger stick, just like you would for a diabetic, and drop some blood on a piece of paper that's encased in a plastic cassette, and 15 minutes later we have results.
And it really is that easy.
It's that easy, it's that cheap, we can do them everywhere, so I think this has got to be part of the plan as we're getting America back to work. So we're going to test you for coronavirus antibodies with the COVID rapid antibody test. You can see they come in these neat little foil packs which protect them from moisture, and the desiccant as well. They're nice and small, just a small piece of plastic. We can see that this is where the sample is going to go, the blood drops are going to go. And then the blood and the buffer are going to run up here through capillary action, and we're going to see either IgM, which is an acute antibody, IgG, which is an old infection antibody, and then the control line will be up here up top.
It's almost like a pregnancy test sort of thing.
It's the exact same technology that we've had for...
We're using blood and not urine, obviously.
We're using blood, not urine, and we use this kind of technology for lots of different stuff. It has antigens, or pieces of the virus, embedded into the paper, and then the antibodies from your blood attach to that antigen, which then causes a color change, and that's why we see the line.
Wow.
And then there's also things called antigen tests, where we do a swab in the nose, and we're testing for the presence of the virus in your nose. So then the paper has antibodies in them connected to color. So you put the antigen in there, and then that interacts with the antibody that's in the paper. So it's that antigen-antibody lock and key technology or physiology that we're using here. And again, this is very old technology. It's nothing new, just applying it for coronavirus. And it's kind of getting people familiar with it.
Gotcha.
In a way they weren't before. But certainly a pregnancy test crossed with a finger stick for diabetes is kind of the way I relay this to people.
Okay, so you want me to give you a finger?
Let's see. Give me the finger. We're going to let that one dry off for a second.
Okay.
We don't want the alcohol mixing with the blood. And then this is just a simple lancet. I'm going to push a button. It's going to prick your finger. You're a pro at this, so we're going to get a little bit of blood. And then we're going to turn over. We can either use the pipette to put the blood in there, but if we can get some good blood dripping out, that's the way I prefer to do it. I think it works better that way. And the more blood we have, the better this test result generally works. And that's good. So you can hold some pressure there. And I left it intentionally on the plastic. So you can see as I'm going to put the buffer on, I put 2 drops of the buffer in there.
Now the buffer is a chemical of some sort?
Yeah, the buffer is basically just, it's more or less just a lubricant.
Oh, okay.
Because as you see, the red blood cells are going to stay there, and as we can already see, it's kind of climbing up the paper, right?
Oh, yeah.
And so that's the buffer mixed with the serum, which is the liquid part of your blood. The red blood cells stay here because there's a little filter behind this piece of plastic that keeps the entire red blood cells there. So the liquid part of your blood and the lubricant or the buffer is what's making this go up. And in a little bit, in a minute or two, we're going to start to see the control line up here up top. That pops very quickly, and then over the next 15 minutes, we'll get to see your results and how we're doing.
Terrific. So fingers crossed, in about 15 minutes, we'll have my results. So, Doctor, tell us about the progress here.
So we've tested 5 people now, and kind of we're into different phases of the progress. Your test was 15 minutes ago, so we're confident in those results. I think Danny's was as well. So we're, these first 2, I can confidently say they're negative. And if we look at them, you can see there's one solid line and that's the control line, right? And that lets us know that the test is working, that the strip is working, and that lets us know to trust the rest of the results, basically. Right, and so this, if you were positive, we'd have a similar line, or even kind of lighter pink. Sometimes they're not as solid at the G, which again, that's for old infection, or at the M, which is for a more acute infection in the last 10 to 15 days. So, fortunately for both of us,
good.
You're negative
And not pregnant.
Unfortunately, you are not pregnant. Unfortunately, you don't have an old infection, right? Because everybody's kind of always upset when I tell them they're negative, right? Everybody wants the golden ticket of having the old infection without having known it, right?
Yeah, because then presumably, if
You're going to have some immunity.
if I was asymptomatic, then I have immunity.
Correct.
And therefore, I want to have an old infection.
The golden ticket, absolutely.
Yeah, I like that terminology, the golden ticket. So we don't have the golden ticket, at least not Danny or myself. And then we also tested Fausto, Israel, and Chris, and they're in progress, but pretty similar so far.
Yeah, I mean, for sure, Fausto, I think, is also going to be negative. These other two, as you can see, kind of they're a little pinker along the strip themselves, right? This line isn't as well formed. And so
that's
this is
Chris. He's just not as well formed.
Well, you can see the difference kind of in one that's done and one that's in progress. The strip is this one's done. The strip is whiter. The line is darker. The strip is still a little pink, and the line isn't as solid. And so, yes, sometimes because we don't have as many antibodies, sometimes people will turn positive at minute 15 or 16 even. And the line, like I said, will be a little faint, but it's on or off, right? You're either pregnant or you're not pregnant. There's no a little bit pregnant. So you either had COVID or you didn't. You're not a little bit having COVID. So any sort of line in there is indicative of a positive test.
And it appears with all of our 5 tests for our team here at our studios, again, still a little bit more with Israel and Chris. They were the last 2 to be tested. But it appears that all of us are likely negative, which is encouraging as a group of people working together. But as you say, none of us even have the golden ticket.
Right, and we don't know the real kind of prevalence in Miami-Dade where we're filming this, but South Florida is presumably, the United States is somewhere along the lines of about 0.5%, meaning 1/2% of people have had it. Varies drastically by geographic region, right? New York is at 20%, LA is at 4%, San Francisco around there is about 3%, and there's a lot of places at 1 or 2, but here in South Florida, we've been lucky or unlucky to kind of have dodged the bullet on the first go-around. I think we're going to be one of the places that is a future hotspot still in this next go-around.
And in fact, speaking of our Miami area and Florida in general, over 60,000 as of this date of recording have tested positive around the state. Over 22,000 here in Miami-Dade County. At least the 5 of us aren't among them. The 6 of us, obviously, you test yourself
I
there
test
regularly.
myself regularly, yeah.
And but as you say, you anticipate that that's going to change. We're going to see more positive results in the next few weeks, few months?
Yeah, well, first of all, I think that the 60,000 is a drastic undercount, right? As we know, there wasn't testing enough before. Right. We just delivered 80,000 of these tests to the state of Florida, so the state can start using some antibody tests, which is good news. And really, we'll get a better sense of how many people actually had it.
Yeah.
When we were missing and not testing people in February, March, and most of April. So that's going to give us information in terms of where we were. And then as we consistently use them, then we'll get a sense of where we're going with the epidemic. And hopefully you can use that information to decide, well, okay, we're now at X number of new cases in this location in this amount of time. Now it's time for a targeted shutdown here. Right? So we don't have to do the whole state. We do just Miami-Dade County, right? Yeah. Just areas that are affected. We may not even have to do the whole county. We just do this region. And so I think that's really where this kind of data and information is going to be useful for us, and it's worth the time and effort to pour into those things so that we don't have to shut down the whole 330 million people again.
Yeah. So it's not a surprise to you that obviously with more testing, we're going to get more positive results.
Right.
Simple math, right?
Almost as if we're looking for it.
Yeah, exactly. Yeah. But we're also hopefully going to find many with that golden ticket, as you say, those that have the antibodies and hopefully are immune from getting it again.
Yeah, I mean, some of the studies have been anywhere from 50 to 100 times the number of confirmed cases is actually how many cases there are.
Wow.
So if we're at, 2 million confirmed cases in America, we could have 40 million confirmed actual cases in America. We just don't know.
Yeah.
So we'll start to see that more and more, and I think hopefully we're going to be a bit smarter about the way we do it in this go-round. I know it's already on the rise in about a dozen states, and so maybe they can kind of stay shut down, do more testing, do more contact tracing, which is, I think, one of the main things that we missed out on the first go-around, was finding those people who are positive and then finding the people they've contacted, so we know to isolate them as well.
For sure. Very important. And for much more detail and information, we hope that you swing by intotomorrow.com. If your local affiliate radio station doesn't carry the broadcast every week, we have it there for you. We can certainly see why Dr. Vincent DeGennaro is the CEO and medical director of API, which is Abacus Pharma International. We invite you to visit COVID-rapid.com. And of course, we'll get you there when you hit us up at intotomorrow.com. Doctor will listen with you on the radio broadcast for much more information at intotomorrow.com.